Cycling is an easy activity that can be done by riding a bicycle, a stationary bike at the gym, or anywhere else that provides it. This activity can also help maintain your fitness and improve your health. In fact, it is particularly great for obese patients as it can help burn fat and keep their body fit during treatment. In this study, we will conduct a demonstration in road cycling to showcase the anatomy and physiology of this exercise towards our body.
Cycling engages most of our body. When cycling, the muscle in the hip called the gluteus maximus function optimally to extend the hip when the thigh is flexed at 45-degree angles. In the thigh, the muscle involved are the hamstring muscles and the quadriceps femoris that is located at the anterior compartment for thigh muscles. The hamstring muscles are responsible for flexing the knee and acting as an extension of the hip. Therefore, we can easily bend our knee and when we put on the pressure on the pedal. Another lower limb part is the calf muscle, which is gastrocnemius, tibialis anterior and soleus. The gastrocnemius and soleus are located at the posterior compartment of the leg, which form the bulge of the calf. These muscles are also called flexor and are involved in the plantar flexion of the foot. The deep muscle in the posterior part will plantar flex, invert the foot, and also flex the toes. For the tibialis anterior, it is located in an anterior compartment that functions in dorsiflex and invert the foot during motion. However, the upper limb is also important for keeping our body balanced and upright while cycling. The muscles that are involved in cycling for the upper limb consist of bicep and tricep in our arms, deltoid at the shoulder, as well as upper and lower abdominal muscles that make up our body core.
The primary muscles used in cycling are mostly located in the legs and gluteus. They are essential to drive the pedals during cycling, producing power which will move us forward. But because pedals limit the range of motion, the extension when riding a bicycle is lesser than other activities, which leads to different effects on muscles and physiological mechanisms. There are two phases in the pedal stroke, which are power phase and the recovery phase. The power phase is from 12 till 6 o'clock, where the force generates to move bike forward, while the recovery phase is from 6 to 12 o'clock. The power phase occurs when the hip and knee are expanded and the pedal is pressed down. Starting from the top of the pedal stroke, the cyclists use their hip extensor, which is gluteus maximus, to initiate power phase of pedal stroke until 3 o'clock on the clock phase. The knee extensors are activated from point 3 to 5 on the dial, vastus lateralis and vastus medialis. From position 5 to 6, plantar flexion occurs due to gastrocnemius muscle, which forces the toe to point outward. The main role of gastrocnemius and soleus muscles is to stabilize lower leg so that force from upper leg is transmitted to pedal effectively. For the recovery phase, there is some knee flexion between 6 to 12 o'clock position in pedal revolution to help bring pedal back to the top. The tibialis anterior pulls the toe up towards the shin from 6 to 8 in a manner called dorsiflexion. The hamstrings, which consist of semimembranous, semitendinous, and biceps femoris, pulls the heel up towards the buttocks from 8 to 10, the iliacs and sos hip flexors, and the pedal stroke from 10 to 12.
Overuse injuries are the main cause of bicycle sport injuries, with common injury sites being the hands, wrist joints, neck, lower back, knees, and hips in contact with the sandal. Besides that, main bicycle injury factors include excessive training, incorrect sandal position, wrong shoe size, and uneven terrain. However, cold weather, insufficient preparation activities, overly complex terrain, and incorrect use of transmission rattles can further aggravate injuries. In terms of the type of injuries, skin abrasions are the most common, accounting for 16.2% of all injuries. Soft tissue contusions and joint ligament injuries closely follow with 15.5% and 15.4% respectively. Other injuries include muscle strains at 14.4%, muscle spasms at 12.4%, joint dislocations and fainting both at 3.8% and tears at 2.4%. These injuries are mostly caused by unreasonable technical movements and insufficient preparation activities during sports. Today, 5% of injuries take more than 1.5 months to recover.
Of course, bike injury, if not treated properly by medical professionals, might evolve into a longer-term issue that can cause you to slow down or even stop cycling. If you are a cyclist with neck injury, it can be difficult for you to rotate or flex your head, making it seem blocked. Suitable treatment for this is actually stretches that can release the stress in your muscle, in your neck, and allow it to move more easily. An osteopath can assist you to hands-on treatment or even assist you to do tailored exercise that can help you to restore back your neck back to normal. Chronic knee pain, also known as patellofemoral syndrome, which is around the kneecap, or we can describe it, the pain, deep discomfort can occur. However, if you are experiencing this discomfort, you should develop a routine of your hip and knee stretches that can release the tension around the kneecap and improve the movement. Another common lateral knee injury, which is IT band syndrome, also can occur where there is pain outside the kneecap, frequently accompanied by the stiffness of the hip on the same side of the kneecap. This could be examined by the height of the saddle itself, because sometimes the saddle is might too high or too low for you. This problem will occur. So, including the mobility and flexibility exercise in your post-cycling workout also can help you to release strain outside the kneecap. Last but not least is the ankle pain, also known as Achilles tendonitis, the tendon that travels around the calf muscle to the rear of the foot due to overuse. The tendon becomes irritated and not having enough time between rise and strength itself, which also occurs in the result of exercising too much and too soon. The suitable method to treat this is actually having enough time for recovery to ensure that the tendon have enough time to heal. For that,
Despite boasting a number of benefits such as reducing our body fat and stress relief, overworking our muscles when cycling can bring harm if not treated well. By understanding how our muscles such as the gluteus maximus, calf, gastrocnemius work during exercise as well as the physiological mechanism of cycling, we can take safety precautions to avoid injuries and help protect ourselves from any further implications. Nonetheless, we still have to seek specific treatment for injuries if necessary. Lastly, it is advised that cyclists invest in a good helmet and protective gear to reduce possible severe injuries. As long as we obey traffic laws and safety guidelines, cycling can be an interesting and beneficial activity for everyone. Have fun and happy cycling!